Okay, well, so thank you all for making the journey all the way out here. So before we get started, my name is Huey Lin. We just started the Houston Methodist Adult Congenital Heart Program 3 years ago, and it's been a humongous success. I want to thank you all for being here. Just to start things out, let's get a show of hands. So how many of you live within 25 miles radius of here? Okay, so put your hands down. How many of you live outside of 25 miles radius from here? Wow, awesome. Well, fantastic. Thank you guys all for coming. I'm just going to give a couple remarks because we have some really exciting things to talk about today and some really great hands-on things to do today. So I'm going to keep this as short as possible and focus on the people who are important, who are invited guests. So the thing that I really want to mention right off the top, and some of you have already seen this, but this is basically hospital admissions in the United States for pediatric versus adult congenital. So pediatric congenital is in light gray and adult congenital is in dark gray. And this is how things are shifting over time. So adults with congenital heart disease for hospital admissions are catching up. And in fact, we think it's probably already overtaken at this point for pediatrics with congenital heart disease. And the reason why you and I are all here is that we think that in the United States alone, there are 1.5 million adults with congenital heart disease, and we think that number will continue to rise by about 5% every year going forward. And the fact of the matter is, I just mentioned a few minutes ago that every single person knows somebody with congenital heart disease. Why is that the case? Well, it turns out that it may affect as many as 1% of all live births. And if you think about the fact that we are now getting to the point where people like you are thriving in adulthood, we can actually expect potentially a normal life expectancy, which means that we will have patients with 70 to 80 years of lifetime exposure for congenital heart disease. So that means that we're going to have lots and lots and lots of people to take care of. The other thing that I really want to mention is this, which you guys have already seen earlier today, which is that this all started probably around 1944 with the first time that we could actually start taking care of blue babies. And then after that, we had some huge advancements that really made things possible for people to thrive. But what's really been fantastic is recently with the transcatheter valve technology, which one of my good friends, Dr. Breinholt, is going to talk a little bit more about, hopefully. That has really made it, and I want to re-emphasize this again, that this is probably one of the best times in history to be a patient with congenital heart disease, because I think things are going to continue to look better and better in terms of the technology that we have to take care of patients like you. The other thing that's important about history is this. So it turns out that if you were born with a congenital heart defect 50, 60 years ago, you had to be born near a major center for cardiac surgery to make it through childhood if you had one of those blue baby defects. And that's why it's so important that we have events like this in Texas, because as you know from all the talk about Denton Cooley earlier today, we here in Houston were a major cardiac surgery center. Other places that you've probably heard about are Minneapolis or Baltimore, like I mentioned in the first slide, and as well as Los Angeles and many other places. So that's why we have a more important burden than many other places in the United States or in the rest of the world to really make sure that we reach out to adults with congenital heart disease and take care of them and give you the support that you need. So this is how we started off with our program in terms of patients in our adult congenital heart program. Clearly, as you can see by the way this curve is trended, and this is the last time I actually had a chance to actually count all these numbers, there's a big need here in Houston. So the reality is that all of you are very complicated. Each of you is a little bit different, and this is sort of how people show up when they show up to see us. And so this may actually be alphabet soup to you, but what we want to do in events like this is to equip you to know about your diagnosis and equip you to know about your family member's diagnosis so that when you go out into the community, you can actually tell people in an educated manner what's going on. So when you meet somebody who has congenital heart disease, you can talk about what's going on and give them the reassurance that there is a way to get care. So one of the major things that I want to really emphasize is what a team this is about, okay? So first of all, there's you and your family members, and then there's us, the congenital heart physicians, who you'll hear from many of us today. And then there's your primary doctors, your primary care doctor, your primary cardiologist, your family care doctor, your diabetologist, et cetera, your kidney doctor. And then one of the things that I really want to emphasize today, and I actually want to introduce them today, is our community groups. So today we have represented the Down Syndrome Association of Houston. We have if you're here, please raise your hand and stand up so we can meet you. And then we have Pulmonary Hypertension Association. Are you here? That's Shirley, right? Yep. Okay, so come talk to Shirley afterwards to find out more about it. We have Heart Gift. Hey, Rachel. So Rachel will tell us a little bit more later about how you can get involved in helping to sponsor a baby coming from a third world country to get life-saving heart surgery for congenital heart disease. And then Marfan Foundation. Hey, Blaine. So Marfan Foundation is a great supporter of ours, and we want to connect you with them as well. And is there anybody I'm missing from the community groups? So what we want to do is we want to create a team. We want to create a family. We want you to have a sense that you are not by yourself in this, and that together we can keep working forward to make this a better experience for you. Likewise, what that means is that this is a team together, and then that means we can go out because you are going to move. You're going to go to other places. So we want to make sure you're connected with other adult congenital heart disease doctors. Let me give you an example. I had a patient the other day who just moved from Tucson. I saw her in the hospital because she came emergently with chest pain. I picked up the phone and I called my friend in Tucson who took care of her most recently. He told me exactly what happened to her. He told me about her last catheterization. That's how we want this to work. We want this to be as seamless as that. That when you move to a different place, that you get picked up right away by another congenital heart disease doctor who can actually know immediately what's going on with you. The other thing that we want is we want to link you with other adult congenital heart disease patients. Ones that are getting care, but also ones who are not yet getting care. So you can go out and you can be an ambassador, just like the way ACHA wants things to happen. And we actually ACHA ambassadors, raise your hand here. If you want to learn more about how to become an ACHA ambassador, come and meet these people afterwards, because this is a vital part of how we're going to go forward. And then finally, how we're going to be represented in the public. We want the public to understand. How many of you guys participated in the Ice Bucket Challenge? Raise your hand. Okay. We need an ice bucket challenge for adult congenital heart disease, right? Because we need to raise money. Because not everybody who has congenital heart disease has insurance. Okay? Not everybody who has congenital heart disease has the means to get it taken care of. So we can help them get it done if we do the right kind of advocacy. So with that, I'm going to give up the podium to the next speaker. So let's see.